This is the NP Business Matters Podcast, episode number 42, with Lyn McCright and Teresa Walding on nurse coaching. Hello and welcome to the NP Business Matters Podcast. I'm your host, Barbara C. Phillips, founder of Nurse Practitioner Business Owner and Clinician Business Institute. And since 2007, we've been providing education, resources, and support about the business of being a nurse practitioner. You can learn more by visiting npbusiness.com and clinicianbusinessinstitute.com. Coaching for nurses and nurse practitioners has been a pretty popular topic on our blog and on the podcast. In fact, the first episode we did with Eileen O'Grady on coaching was given rave reviews, and it's one of our most downloaded episodes thus far. Today, we are continuing to talk about coaching, this time from a bit of a different perspective. I'm talking with Lyn McCright and Teresa Walding of Advancing Nurse Coaching. You'll hear them talk about nurse coaching, resilience principles, and how it all applies to advanced practice nurses, either in their own businesses or working through an organization. We'll link to their website and contact information, as well as studies that they have shared with me about the outcomes of nurse coaching. So let's go ahead and get started. So one of the most common questions that I get that I'd like the two of you to discuss is about nurse coaching, because so many people are interested in it, probably for a lot of different reasons, but I think because some nurses and nurse practitioners are getting burned out of clinical work, and many want to be able to work from home and some other things. So let's hear your take on nurse coaching, and because you guys have been doing this for a while and working with nurses becoming coaches.
Oh, thank you, Barbara. What a beautiful opportunity. We have a national board certification now in nurse coaching. And it's really quite remarkable for us to be able to say that nursing is actually the first and the only profession that is offering a national board certification in coaching. So we're way ahead of the curve. It's only 7 years new, and it's through the American Holistic Nurses Certification Corporation, AHN-BC.org. Margaret Erickson saw that this time was coming, and that what would be needed now is more so to work with people in regard to health promotion. And that time certainly is now, when people have realized that the ball is in their court when it comes to their health. So coaching is a very different aspect than what we've traditionally seen ourselves as in the health professional careers. Instead of us standing over the patient, shaking our finger, telling them that they've got to do this, we're actually, in a sense, walking beside the patient and maybe a little bit behind, because they are working toward their goals. And we're simply there as a sounding board and to help facilitate that for them. The way that we look at coaching is through what is described as insight. We want them to have a sight from within that can help them take their next step. And it always has worked that way, but we haven't always seen it. When they understand their own motivation, they will be able to do what's next in their best interest for their health. So it's just so exciting now to be bringing nurse coaching board certified to the profession. We actually have 5 privately owned schools here in the U.S., one in Canada, and 3 DNP programs that can sit for the National Board Certification. So they're spread all over. The DNP programs are in Minnesota, Texas, and Florida. And of course, now Teresa and I were the very first online program for nurse coaching, but everyone has gone online now. And it's such a beautiful thing to see the evolution of the nurses that are doing the coaching in our area specifically, because we focus on resilience. And I want to just share with you something that one of our colleagues wrote recently, and it's just this. The year 2020 will reveal its gifts in time. That is, if we know where to look. The gifts will come from within. How we see the world, how we experience our relationships, how we appreciate the moment-to-moment breaths we take, and the relationships we have, and the ones we have yet to make. Developing an eye for the gifts of 2020 is what will allow 2021 to continue to evolve with love. Take a moment to invite the gifts of 2020 to be revealed, to pause for a moment, to send love to those who are struggling, to slow down to the speed of life so we can get rear-ended by love. Here's to you and all that you bring to life. We know that the NIH study has shown that nurse coaches are 25% of us are in the hospitals, 25% of us are in private practice, and 50% work wherever nurses work in the community. We've also got numbers that show that 70% of certified nurse coaches say that they have improved job satisfaction. 80% say that they have improved personal relationships, interpersonal relationships, and 85% say that they have improved personal health. So we're happy, healthy nurses that are good communicators. And the 3 areas that are seen primarily by certified nurse coaches now are, first, stress and anxiety. Who knew? Secondly, all the chronic illness. It could be cardiac, it could be diabetes. And the third thing is actually pain. So those are the areas that nurses are working in. And you'll see when you look, it was the Journal of the American Association of Nurse Practitioners in May of 2018 when this was published, a research survey of certified nurse coaches with recommendations for advanced practice nurses. So what they were saying from the NIH was, because nurse practitioners deal with the complex patients, it totally makes sense for them to have the nurse coaching background. And there are a lot of reasons for that. One is simply for ourselves to, understand that we have our own recognition as a nurse coach. But secondly, for the public to know that we have a national board certification in coaching will be every day more highly considered by the public. And then also we have professional recognition among ourselves. And my sense of things as a person who's been doing coaching for 30 years, I think I may have actually invented it. I didn't call it coaching, I called it consulting, but I opened my private practice in 1986 in California. And that is where I began sharing the principles of resilience with my entire community, because my background is public health. So it worked in all areas. I worked with business community groups. I worked with private patients. I worked with a large industrial firm that was having on-site job accidents. I spoke to an outpatient mental health clinic, both the patients and the staff in the same room at the same time. I did weekend workshops at the Carmel Community Center. So I just embrace the entire community. There is no part of the community that doesn't benefit from the principles of resilience. Teresa, what would you like to say?
I'm just grateful to be on this journey with Lyn. Lyn and I have been working together for about 10 years, since, well, I guess almost 11 now. And we actually met through American Holistic Nurses Association when Lyn started the Central Texas chapter. She called me and asked me to present for the first meeting. And I was like, oh no, I don't speak in front of people. And she is relentless. She called me a week later and she goes, well, how about now? And so I said, yes. So Lyn started helping me to really see the vision of what we can do as nurses to bring health and resilience to all of our communities. And it really starts with us first. It was like, oh, we can do this and we can do this and we can, teach nurses how to do a lot of the holistic modalities that we, use and aspire to have. And we just couldn't find our footing. And then we went to a conference in October of 2015, and that's where I learned about the principles of resilience. Dr. Keith Blevins was our speaker, and that was the only thing he taught for Friday night and all day Saturday. And Friday night, he talked about like separate realities and how thought works and how we each have that separate reality between each other, but also within ourselves, known as moods, attitudes, feelings. Well, I never made that connection. I mean, I knew I had them. I didn't know the power that they had. And I really had no expectations of what I was going to learn at this conference until Saturday morning at 9:31. And he was talking about separate realities. Well, I'm going through a little bit of turmoil in my family with adult children. And I heard every single person is responsible for the life they're creating through their own use of thought that comes out into the world for everyone to see. I went, that's absolutely true. And I heard it on a level, not an intellectual level, but an insight, like it had implications for all aspects of my life. And I had been experiencing a lot of pain at that particular time, and it went away. Like in an instant, like with the insight came this side effect. And I thought, okay, what is he really talking about? How does this play into life? And by the end of the conference, I think both Lyn and I were like, this is how we want to bring principles of resilience to nursing, because nurses are suffering. We get up every day, we go to work, we, take care of everyone else to the best of our ability, but that doesn't leave a lot of time for us. And I see nurse coaching as really that bridge between nurses taking care of themselves first in order to help others take care of themselves. Because if I had never been coached before that, I have had people who I've talked to, girlfriends I've, quote, vented to, or we try to solve the problems, through conversation, but we know we don't really have any power to change anything from that direction. When you change from within in that way, it changes every aspect of your life. That one insight put me on a trajectory that I would never expect. One of health, one of healing, all the things that Lyn said, better in communication, interpersonal relationships. I stopped trying to control people. Like, if they would just do this, everything would be okay. Well, we know that doesn't work, but in our mind, we don't say that we're doing that, but we do. If people would just think like me, everything would be okay. And it's just doesn't work that way. And so we each get to experience that through our own thought, and we naturally change. It's incredible. I just, I want every nurse out there to listen, to know there's hope, that we can do this. And if you don't have a coach, get one.
One of our nurse practitioners was working with an 85-year-old diabetic, and she was having a terrible time remembering to check her blood sugar, give her insulin. Come to find out, she had lost 4 family members in 3 months, and she was just beside herself. Jan was able to sit with her quietly, and she said, "Look, you can't be in 2 places at once. You can't be here now, taking care of yourself and living in the past." And that lady got fire in her eyes. And she said, "Do you mean to tell me that I'm not taking care of myself because I'm thinking about them? I can't bring them back, but I have the rest of my life to live." And 3 months later, she came back with more blood sugar checks in 3 months than she'd had in the previous 3 years, and an A1C that was ideal for her. She heard something in an instant that potentially changed her life forever. We had a young student working in the emergency department, and they wheeled a 25-year-old man in, and he said, "Well, I'm here because I want to talk to the doctor. I want to make some changes, but I want to know what's possible." And she said, "Well, the doctor's over there and can't come right now, but let's talk." And as the conversation went around, she suddenly had the insight to say to him, "You know, calories are energy, and you are all fueled up to go in any direction you want." Well, he was morbidly obese. He couldn't even ambulate independently at age 25. He heard something very, very profoundly. Now, in that situation, we will never be able to track what happened next, but the potential was there. He had already heard from the nurse that all the limits were off. I don't know what the doctor said.
I think that's why coaching is like this magic bullet or the easy button. It's like when you know where you're coming from and you're holding space for someone else and you're not judging, you're not trying to create an outcome based on your thinking, but on what that person wants. Deep listening, nurses, I think, naturally have that. But I think there's sometimes we get caught up in our day-to-day where our mind gets busy. We don't really know, what's coming next. And then you add on the exhaustion factor or, whatever's going on in your work. There is a place within us that is quiet, that knows exactly what to do. I call it the eye of the hurricane. It's everything can be going on around you, but if you know where you are and where you're coming from, thought can slow down to a place where you just know exactly what to do next, what to do next, and what to do next. And I experienced that many more times after learning about the principles. I had experienced it before that too. But to be able to recognize that that's what was happening, even in the moment of the chaos, was just amazing to me. I had a patient in the post-anesthesia recovery for 6 hours and, she couldn't breathe. I mean, take the BiPAP off and she can't breathe. And so it's a really big deal. And so we worked, and at the end of the day, I just kept, working with her, keeping her calm, talking to her, letting her know what was happening. And we made it through. And it was probably the easiest thing I had done in a long time. And I can't always say that that's happened. But I think coaching opens up a space within us that allows us to listen at a deeper level. It gives us new eyes to see what's possible and how we can really help people help themselves and be there in that aspect of it And it relieves us of a lot of responsibility that we may feel that I'm responsible for this person and I have to make sure this happens. The reality is you're not. And I don't know, somehow that was eye-opening to me. Like, I should have known that. But I think in my desire to help people, I always thought I had some control over it, just like I thought I had some control over the other things in my life. And as it turns out, life has gotten easier. And I think that's why we call them the principles of resilience. It's always available. It's always there for us when we have the eyes to see it.
We actually had the experience of talking with the Texas Organization of Nursing Leadership. All of the 715 hospitals in Texas were invited. We did the 3-hour pre-conference, and what they found when they worked with us was what's described as the easy button. And it was Teresa's supervisor that gave us that terminology. But it's the expectation that nurse leaders have about making, well, I don't even want to use that word. How would you describe the easy button?
I think that the easy button looks like everyone doing their thing the way they're supposed to do it without a lot of interpersonal relationship problems. You know, when things are busy and stressful, nurses have a tendency to blame others for things that are happening. Well, if you would just do this, I wouldn't have to do that. And I think that's what she was talking about. But when we get to own our thoughts about those things, we can see we are responsible for the way we're acting in any circumstance. And even though it doesn't look like we have a choice sometimes about what is happening to us, we always have the ability to see through that and respond instead of react. It's very fast. It's in the moment. It takes no time at all. But knowing about how your thought works gives you access to that more often. It's like your safety net, you know, that little piece that says, oh, I see what's happening here. I'm letting the circumstance dictate to me how I feel, and it never worked that way. Just like it never worked for us to tell patients what to do. It's the way the system is built. And we're able to really take a step back and really evaluate what it is we're doing as human beings. We're here to enjoy each other, to love each other, to do the best that we can. I have never known a nurse that went to work to do a bad job. Nobody. But sometimes we leave there feeling like that's what happened. These principles of resilience take that self-blame and doubt away. You did the best you could for the day that you had. Tomorrow's a new day.
Well, and speaking of the day, I just would like to let you know that Teresa's been interviewed for a book that's coming out in October, The Eye of the Hurricane, and she shares her experience there. Can you share with us, Teresa, what you found that day?
That day was a pretty busy day, and you know, when you have a lot of critical patients back to back, it can be a little bit harrowing. And I found myself in a state of calm and ease. There was a lot of stuff going on, and at first I was like, oh my God, what am I going to do? I have 2 critical patients at the same time. What do I do? How do I split myself to take care of these people? And I just took a couple of deep breaths and I thought, you do what's next. And so even though all of this stuff was going on around me, and it did kind of come in, and I started kind of worrying about something, and I realized the only thing I could do was take care of these people the best way I know how. And that's exactly what happened. Everyone stabilized. Everyone went to their rooms. Nobody was on a ventilator. You know, it was an amazing feeling to know that I could be in complete chaos and the whole room is doing all the things that it's doing, but I could be that calm place, or the eye of the hurricane, where there isn't chaos and there's not what ifs. It's just what's next. And it was one of the first times after learning about the principles that I was able to step away from it and process, oh my gosh, that's truly how these principles work. It's me. It's not everyone around me. And I have found that place much more often. And we all go in and out of that state. Everyone knows what that state feels like. We know when we're in flow and we're doing what comes next and it feels right and it feels good. The one thing that I noticed when I was processing this is I did not regret one decision. Every decision I made was the exact decision I would have made again in hindsight. But hindsight is insight. We can look at things from, a distance and say, oh my gosh, that's how this works. And we are able to live in a way that is best for both of us, the patient and the nurse.
Well, and there was a time when you called me and you were driving around worried about the COVID coming. And what did I tell you, Teresa?
So when COVID came to my hospital, there was a lot of confusion, as there was with every hospital. PPE was a problem, surgery shut down, the hospital shut down, everyone is sent to different units or different jobs 3 or 4 times a day. And I started to worry. I guess that's my default. I have learned that that's my default when I don't know what to do. And so my daughter also worked at the hospital with me. And I was like, well, I'm okay if I get COVID, but if my daughter gets it, I'm not sure I can handle that. And so I was having all these scenarios in my head about what to do and what might happen and the what ifs. And so I was driving around and I called Lyn and I said, well, so I've been spinning on this for a couple of hours. And she said, Teresa, stop. You are as safe as you've ever been in this moment. And I knew that was true. It was like the whole world just, whoop, right here I am. Nothing had happened. I made it all up. And I was believing my made up story. How many of us do that? We do it all the time. And so just remembering that I can only live in this moment allowed me to have resilience through that actually through this whole pandemic. Because not 6 months later, I was on call. I worked 34 hours out of that weekend. And at the end of the night, I took a picture of myself. And I looked at that and I was like, you're as clear as you have ever been. We had back-to-back cases for 2 days. And again, there was that feeling of camaraderie. We had each other's back. We did everything that we could to protect and heal these patients. And it felt great. It was like, wow. Even in the midst of taking care of the COVID patients and, all of the other stuff happening, that was an amazing place to be. And I'd do it over and over and over again, just to have that feeling back,
We know that nurses are naturally resilient, which is what all human beings are. There's nothing that needs to be added. There's nothing that needs to be memorized. There's not a need for us to turn ourselves over to other health professionals when we can't handle it, because we are naturally resilient. Now, certainly there may come a time when a referral is appropriate, but for the vast majority of working nurses today in every clinical area, we are resilient. So advancing nurse coaching is all about helping, there I go again, guiding the nurse towards seeing her own natural resilience and watching that blossom. It's just a beautiful, beautiful way to see how this is spreading out in all areas, in education, in practice, in research, in policy. Speaking of research, we did get back the information from the statistics department at Baylor University. And what it shows is that on the three measures that we used for testing well-being and resilience, our students had higher scores after each of the three courses. But oh my goodness, our words are backwards. It wasn't that they had anything added to them. It wasn't that they actually increased their resilience. What it is that they see naturally by themselves with their own understanding of why and how they are resilient. So it's that understanding, it's that seeing for yourself that is the most important part. We had an opportunity to be at a American Association of Nurse Practitioners conference in Indianapolis, Indiana in 2019. And I had an exhibit table and I had a survey. And of the 229 NPs that came to the table, 60% of them said that they would like to become a nationally board certified holistic nurse. And 65% of them said that they would like to become a nationally board certified nurse coach. Well, this was astounding to me because none of them had ever heard about nurse coaching until they came to my table. But before they were done, 65% wanted to become nurse coach board certified. How is that possible? Because we know that something is missing. And in advancing nurse coaching, we have an opportunity for the first two courses entirely for the nurse to learn about her own resilience first. And it's an interesting thing to say, we have no academic learning. There's no memorization. Everything that's learned in advancing nurse coaching is learned through insight. We offer a framework and people see it coming through their work, coming through their life on a day-to-day, moment-to-moment basis. That is where the learning occurs.
Yeah, I was just thinking, I wrote a goal. It's been at least 20 years ago now, because I had a desire to help people even in the middle of the night when no one's around. That's when we see a lot of people that just can't handle whatever's wrong and come into the ER. And, I worked in the ER, not a lot, but floated there often. And it seemed like we would always see like the young moms and the babies or the older folks who just got so worried they decided they needed to come in. And, really nothing was wrong other than they got so worried they didn't know what else to do. And they got caught up in their thinking, just like I did. I didn't know these principles would be the thing that would bridge that gap so that when people do get worried and they don't know what to do and they're ambivalent about making a decision, that you can realize that your thoughts have run away with themselves and you can actually look at a situation without the feelings and then know what to do. That's what these principles offer us. They offer us the opportunity to have clarity in the moment to know what to do next. And I think I can think of many times, patients I've taken care of and even myself, when I thought, if I had known this, it probably would have saved an ER visit or I would have gone sooner. And it's an important thing to realize that, when you start worrying and you start game playing, my husband calls it game playing, like, okay, I can do this, or I can do this, or I can do that. And then you guess what the outcomes might be. We can't know what an outcome is going to be because we're not there. We're in the present moment trying to decide what to do. And whatever we choose, we still won't know what the outcome is because we're not there. But as soon as the outcome is apparent, it's the present moment. That's all we have. This moment in time that is our life.
There's a lot of old thinking that's dropping away now. old thinking for ourselves personally and obsolete thinking for the way things have always been done in the health professions. So our job now is to notice. And the first thing that we notice is how to take care of ourselves. When we feel thirsty, it's time to take a drink. But we have to notice first to be able to do that. Self-care is not a big, hairy deal. Self-care is taking a nap if you need to, standing up and moving around the desk if you need to, walking down the hall and getting a drink of water when the time is right. It's taking care of ourselves first. Not denying our own needs is how we are going to be taking care of others.
So when you are, I've heard you guys mention the principles multiple times. Would you say that's the first principle is the self-care? And then what would be some of the others?
Yeah, I love that aspect of it. I'll just mention briefly that the three principles actually are mind, consciousness, and thought. So mind is simply the source of all things. Consciousness is how we experience life, and those are just givens. Those are in the background. It's thought that we have to use as our rudder. And one of the realizations that I had, an insight not long ago, it's funny to me. I mean, you'll like hit yourself on the forehead and think, why didn't I realize that before when you see something for yourself? What I saw is that self-criticism is the most damaging thing, and we do it all the time. So now that I've seen that for myself, I have an opportunity to notice when that comes up. And it does come up over and over again. But the thing about insight, the thing about working with thought is also to know that there are no tools, there are no techniques. We already have within us everything that we need to do life in a perfect way for ourselves in this lifetime. We are not broken. There's nothing lacking. We have everything we need. And of course, there will be times when we have to pull on all of our resources. How did that mother take the car and lift it off of the baby? I mean, everything that she had went into that. But we never know when we're going to be called on in any given moment. What we can know is that we are completely whole and naturally resilient. That will take care of us.
And that's something, though, most people don't get. They don't understand that it's an inside job. So how do you work then with your clients, our patients, or just ourselves? I mean, there's plenty of men and women, nurses, nurse practitioners who don't get that.
This is the revolution. I wrote an article in 2017, and the title of the article was "The Revolution in Nursing Begins." And it is, first of all, seeing that for ourselves, and secondly, being able to share it with others. And what that looks like to me is nurse coaching. I see nurse coaching as the future of nursing. Everyone needs to know this inside information, that we are living our lives from the inside out, that our thought is the most powerful force in the universe. And we can use that to the benefit of ourselves and for the benefit of all of mankind. We have just, our vision for Teresa and myself in advancing nurse coaching is to bring new life to ourselves and our profession. And beyond that, our mission is to bring resilience to all of humanity through nursing.
One of the questions that I would like to ask, you mentioned the national board certification for nurse coaches. And I know in a previous podcast, we've certainly had people come on about coaching, and they talk about, I believe it's the International Coaching Association or something
ICF,
very similar.
yeah.
Yes, ICF. So how is this different from that? And how do people choose between a certification if that's what they want to do?
Yes, the ICF started first, so they're the most well known. And 5 years ago, they were celebrating their 17th anniversary. So we know that is considered the gold standard. Now, what that is life coaching. What we are is nurse coaching. Life coaching was developed for business. Nurse coaching was developed for the professions. And in our program, we actually offer the same program to all licensed health professionals. So, for example, if you were in class with us right now, you would also have two speech and language pathologists from Canada in your course. But what we are seeing is that the professional recognition is going to be needed for us as a profession, because this is the leading edge of nursing. And because the Gallup poll shows every year since 9/11 happened that nurses are the most ethical and the most honest, the public will very soon see that they will have a choice between a life coach or a nurse coach. And that's what makes the difference. Now, a life coach can come back and take some holistic CE hours and become a board certified nurse coach. And it is my hope that all nurses become nationally board certified through AHN-BC.org, American Holistic Nurses Certification Corporation.
So since this is the NP Business Matters podcast, and I know a lot of nurses and nurse practitioners are very interested in this as a career path and as a business path, is nurse coaching something that is reimbursable if it was your own practice, or are they looking at a different revenue model?
Well, we're exploring those possibilities right now. It takes at least 3 years for something to even be considered as billable. And that process has begun for some coaching programs, but it happens to be the ones that are owned by the physicians. Now, Teresa, can you say something more about the private pay options, HSA, and all of that?
Well, most of the nurse coaches that I know that are in private practice are doing self-pay. They can use their health savings for it if they're allowed through their health savings programs. But most of the people everybody that I have in my private practice are self-pay. And the models that we use are usually packages. You know, it's difficult to do a one-off coaching session with someone and expect to see a lot of results. So ideally, you get them at a minimum of 4 sessions. So you build a package around that. And it takes the money thing off the table so that people can focus on the coaching. And so I haven't had any problem with people, booking the 4, 6, or 8 coaching packages, because they see the value. Once you start getting results in your life through coaching, it's like they can't get enough. When someone actually listens to you and you take away something that helps you in your life that you didn't see before, it's like a drug. You want to have a little more of it because it was so incredible for you. And that nurses can do that in private practice through their own business. But remember, we can take it wherever we work. Coaching is a portable skill. And now with, Zoom and all the virtual platforms, you can work anywhere you want to. And that's the beauty of being able to connect with so many people this way.
Let's talk about that for a moment, because a really common question is that a scope of practice for nurse coaches, and particularly practicing across state lines. Because obviously, if you're doing telehealth as a nurse practitioner, today you still have to follow the scope of practice and be licensed in the state that you're in, as well as the state that the patient is in. So is that any different for nurses, nurse practitioners who are doing coaching across state lines?
It's the same. It's based on where your licensure is. So in a sense, the registered nurses have an easier time because Texas is we have reciprocity within 26 states. For the nurse practitioner, yes, it is currently very, very much limited to the geographic boundaries of your license, which is, as you know, why nurses who live adjacent to 2 state lines or 3 state lines have often been licensed in all states, all of those states. I talked to a travel nurse the other day. She's licensed in 38 states. Wow, I wouldn't want to keep track of all that. But it's interesting, the evolution of how our profession is changing. And I think that we do have the scope and standards of holistic nursing. That's what we're going by now. We have a brand new 2nd edition of the art and science of nurse coaching. And in fact, Darlene Hess, who was one of the original authors on the 1st edition, is going to be speaking to our Austin area chapter of the Holistic Nurses in September. So I would love to have you all enjoy joining us on that. Our Facebook group is Austin Area Chapter Collaborative. I think that what we are seeing now in microcosm is practice goes ahead of law by about 10 years. So one of the things that we see in the 3rd edition of the Scope and Standards of Nursing and in the 2nd edition of the Art and Science of Nurse Coaching is that the 1st edition is embedded into the book, because we are aware that at some point in time these questions will be raised about practice. And you know, right now we have a consensus model that has been approved for advanced practice by about 2/3 of the states. And there's a bit of a problem there, because I think it was unintended. I'm sure it was not intended. But what it says is that only nurses that have DNPs can teach. So, in other words, the PhD nurses at colleges have to keep their position that they're in right now. They won't, if the consensus model were to pass, they would not be able to be employed in another institution. The other quandary that raises is that locks us in to the biomedical model. And I'm one of the privileged people who came along just 8 years after the first nurse practitioner program was started at the University of Colorado. I happened to be at the University of Minnesota, but the School of Nursing wouldn't even hear about junior doctors. So we had to be housed at the School of Public Health. Now, of course, all of that has changed. But we're out here leading the charge. Our practice today is what we are creating day by day by day. We're actually, even though Teresa and I have been in the business of teaching nurse coaching for 5 years, we know that we're still on the leading edge of creating what it is that nurse coaches do. It's an exciting time. Be a part of that change that you want to see.
Which is something we all want. So Ken, this has been a wonderful discussion. And I'd like you, because I know this question will come up, talk about your program and how people can get involved and what's involved in the program.
Right. Well, it's such a simple website, just nursecoaching.com. And our website is being redone right now. So if you have a hiccup, don't worry, just come back and it'll work. But we love the way we set our program up. We set it up in 20 contact hour increments. This is continuing education for nurses through the Board of Nursing State of California. And we actually have 4 courses. 3 are required to sit for the National Board Certification exam. But the first 2, essentials and understanding, are learning about our own resilience. And once we understand how we operate, how we work in real time, we can understand how everybody else works. Just for example, Teresa talked about separate realities. I think that is going to do away with bullying in our profession. So the 3rd course is actually our coaching course, and you'll be assigned a peer coach to work with for 4 hours, and then you'll log in 60 hours of time talking with clients, either on a volunteer basis or in your work. Our nurse practitioners do it at those 60 hours in 20-minute increments. And they do bill Medicare, and it's under consulting. So what we do in the 4th course is talk about how to bring this to the profession, how to bring this to colleagues, how to bring this to our superiors, how to work with this new language, new way of understanding, new way of being. This is the revolution in nursing.
Maybe I need to come and take this course as well, because of the work that I currently doing with medical hypnosis.
Oh, fabulous.
I've always felt that nurses are the original coaches.
Yes.
And that we just need to learn how to ask the correct questions so that they understand that they have those answers within them. But I like the whole approach of really getting to know ourselves first, because it does start with us. And that's something I've always told my patients, that you have to be number one. You've got to take care of yourself first before you can ever take care of the rest of your family or anybody else in your life.
Well, and insight, intuition has long been talked about in the profession, but it hasn't been given much credence. The holistic nurses actually call insight and intuition informed knowing. It's knowing that comes from a source beyond us. And when it comes, we know.
Right, that inner knowing. And we do. Every nurse has relied on that at some point in their lives. Every single one of us.
We've known that we have to run down to the end of the hall. And when we get there, we know exactly why.
Right, exactly. I have loved every minute of this. Are there any last minute words or anything I haven't asked you that needs to be said at this point?
Well, these really are shifts in perception. And Teresa, maybe you could just close with that.
So when we have new eyes to see, after we've learned how we work, we have shifts in perception of our relationships, of our jobs, of our family, and even the relationship with ourselves. We become more compassionate. We stop judging as much. I'd like to say we stop judging altogether, but I know we're human. But this allows us that space to really take a look at what's going on in this world and with you and live your best life. And I think that if people experienced what it was like to be coached more often, like someone really embodying this work and showing you how it can change your life, everyone would have a coach. Whether it's your mother or your sister or the nurse, everyone would benefit. That's how change happens. It starts as a thought. You have a thought, you make a decision, you go in a direction, and you keep doing the same thing over and over. But with this insight into how you work, it's a beautiful thing to watch it unfold in your life. And you know that you created it.
Oh, Teresa, yeah. And you've said about being coached, and we don't often talk about it, but we need to. When people come into our program, not only do you have an opportunity to coach and be coached in our live coaching call class, you have an opportunity to be coached by faculty. And we have 8 sessions for you within our program.
What a gift.
It is.
It is. Thank you so much, Teresa and Lyn, for being with us today on the NP Business Matters podcast. So I want to thank Lyn and Teresa for taking time out and to share their information with me and to talk about resilience and how that fits into this. This is such a great topic, and so many of our listeners are interested in this and nurse coaching, regardless of how you want to walk that particular path. Make sure that you take time to head on over to npbusiness.com, where you'll find the notes for today's episode, as well as all the resources, links, and contact information. I also want to remind you that starting a coach business, it's just that. It is a business. So while you're taking a look at the show notes, make sure you look around the blog and take note of all the education, resources, and support that is available to you on the topics of the business of healthcare, practice and business startup, and so much more. So again, that's at npbusiness.com. I'm Barbara C. Phillips, nurse practitioner and founder of Nurse Practitioner Business Owner. I look forward to seeing you in the next episode of the NP Business Matters podcast. Bye-bye now.